finding out innovative ideas, and maybe there are discoveries which are coming forward. So I think this is the one lecture which is very, very innovative. Everybody should listen. You can be a part of it. So I request you all first, please kindly switch off your mobile phones, or you can put it on a silent mode. The chairperson, due to unavoidable reasons, is not available today. So everything will be done by the co-chair, and she's Dr. Shushma Singh. So I'll just say a few words about Dr. Shushma Singh. She's currently working as an associate professor in biotechnology department, and she's in charge of pharmaceutical technology in NIPER SAS Nagar. Dr. Shushma received PhD from the School of Life Sciences, JNU New Delhi, and Masters of Sciences in Biophysics and Molecular Biology from the University of Kolkata. She served as the research scientist at the National Center for Cell Sciences from Pune. She had 9 research articles, 2 review articles in total. She has got 28 publications. So she will, chair, and she'll become a co-chair of this particular session. So we are going to start with the technical session. I hand over to Dr. Shushma. So we are going to start the technical session number 10, which is on startups, challenges, and opportunities. Thank you.
So, good morning, all of you, and a very warm welcome to this session. So, the first speaker of this session is Mr. Tarun Gupta, and before he starts with his lecture, let me just introduce the first speaker to you all. Mr. Tarun Gupta is currently working as the founder and CEO of Sai Cure My Healthcare Technologies Private Limited, which was founded in 2018. And Vaidya RX, a software application founded in 2021. He completed his Bachelor of Technology, BTech, Civil Engineering from Delhi College of Engineering in 2005 and MBA from Management Development Institute, Gurgaon in 2008. He has an year of experience at Rights Limited as a civil engineer, 5 years of experience at O-Zone Networks Private Limited as a national head marketing, sales, strategic partnerships, and special projects. 3 years experience in Cogitas as an associate vice president. His expertise lies in areas of healthcare and life sciences, medical informatics, human-computer interaction, and open innovation strategies, which has garnered more than 40 national and international awards and recognition that include research articles, business cases, white papers, grants, invited talks at various international forums. An avid practitioner, coach of mindfulness, mediation, eco-conscious lifestyle, and world traveler, Mr. Tarun exhibits a perfect balance of intercultural empathy and servant leadership to effectively lead cross-functional teams. He has work experience across India, USA, Asia, and Europe. Sai Cure My develops artificial intelligence and digital health products to decipher actionable insights from medical big data, predictive analytics from medical images, EMRs for precision medicine in chronic diseases. The platform augments personalized health outcomes and brings value across patients, providers, and biopharma through a fully integrated solution. His roles are business planning and implementation, product design and implementation, business development, and strategic partnership. He leads a team of 30 scientists, engineers, clinicians across 2 countries and developed 2 novel healthcare artificial intelligence products from R&D concept phase to commercialization. He strategized overall clinical research and innovation program, crafted regulatory and go-to-market roadmap for new products and business development. He has obtained funding from 2 venture capital firms and 2 nationally competitive grants from Pfizer and Sanofi. Developed strategic partnerships with 3 biopharma, 5 medical research centers, managed investor relationship and external collaborations with large hospital networks. His research aptitude, perfectly balanced with entrepreneurial skill set, helped him gather various grants for establishing his ideas. He was awarded CEO Award of Excellence twice in 2010 and 2011 respectively, when associated with Ozone Networks Private Limited. With this introduction, may I now invite Mr. Tarun Gupta for this speech, for the talk.
Okay. Somewhere else as well. Okay. Hello. Hello. Audible? Clear? Okay. Cool. So first of all, thank you so much for extraordinary introduction and great warmth in introducing myself and inviting me to this prestigious institute. So everyone has heard about NIPER. I think it's not one of the best. I think it's the best institute in the country at this point. And my background. So my background. I am an engineer, MBA. So I do not come from this field. So I've heard about it from multiple sources. So it was a proud moment to be here. This is my first time in the campus, and so I'm a runner. So in the morning I'd gone for my 10-kilometer run, and this campus is absolutely outstanding. I've literally stayed all my life at Ames campus. My parents are doctors. Now my wife is also a doctor at Ames, and I was mentioning to someone that this is 1,000 times better than the campus that I've ever been. And my office is in IIT Delhi. It's even better than IIT Delhi. So amazing campus, and I'm sure some of them are studying here, and some of you are guests. So go and look around the campus. Do not miss it. If it was outside India, I'm sure they would have charged for it. So it's a beautiful campus, and thank you for inviting me, and thanks for giving a wonderful introduction. I'm Tarun, and my background, in a nutshell, I'm an engineer, an MBA by training, and I've done super specialization in marketing in US as well, and I've worked in corporates before, startups, and then have my own startup, which is a small one, and hoping to do more things in future. And currently we are based out of IIT Delhi, and we have, in fact, you'll be surprised to know we have one technology office in Shimla. So every 3-4 months I go to Shimla, and that's why I frequently visit Chandigarh. So we have one office in US, which is very, very small team, but that's what we do. And we specialize in the field of healthcare or health tech, consumer technology. And we work in the field of AI and machine learning, which I will very, very briefly touch because it's a very different audience. And as mentioned, one of the things which we do, which I'm not going to talk here, but still, because I was just having an interaction with ma'am. So we work, one of the products that we are building, that's in R&D stage. These things takes time. So put it very simplistically, it took a lot of time for me to absorb it, but still I will talk about it. So we are looking at non-invasive retinal images, which we get through angiography of the eye, through a process called OCTA, which is optical coherence tomography angiography. What it does, it actually looks at the micro vasculatures within retina, and OCTA actually gives a depth resolved motion contrast 3-dimensional image of the retina. And in very laymanish terms, it actually tells you maps the flow of the blood within retina. Now, why we do that? So we look at those images and the vasculatures of the retina, and it has been published in Lancet and AMA. In fact, we are working with ophthalmologists and cardiologists from AIMS who have been supporting us theoretically. The vasculatures of the cardiovasculatures and the retinal vasculatures are very closely linked. So any deviation in microvasculatures in retina, like lowering of vessel density or lowering of perfusion density, or there is a central zone in retina which is called avascular. Jahan bhi A add hota hai means there is no vasculatures there. Avascular foveal zone. It's usually very circular in a normal eye. It gets distorted in terms of convexity and concavity, and we map that, quantify that through image processing, and then we actually quantify that number and put it into deep learning, transfer learning. Don't get intimidated by these words. These are simply AI techniques which you can really learn, to be honest, in 6 months. It has become that easy. And then we try to build a predictive model as a pre-screening tool to actually predict a cardiovascular event or a coronary artery disease. So that's, we won grants from Pfizer, Sanofi, and many other places. In fact, I was talking to one of your colleagues sitting there, and I was telling that if you have a great idea and a science behind it and you've put mind to it, heart to it, government and these private people are really, really keenly looking, profoundly looking for young people to actually put money into a concept and an idea. So in that context, we are, should I wait? Okay. So in that context, so that's the work we are doing in artificial intelligence. We are looking at those retinal images. But that's not what I am here to cover. I am working on some other area which is related to your industry. And so guys, I must tell you one thing, and I just mentioning to one of your batchmates, startup is not a very fancy word. Entrepreneurship is actually a French word which actually a lot of people do not know. It's actually how you aggregate the best resources available to you and create a maximum output of it. And apart from the AI part which we cover, working on retinal invasive for measuring cardiovascular event, this concept is purely, I'm telling you, a startup is nothing but a game of power of observation and relentless pursuit to actually ensure that a problem actually exists. I was mentioning exactly 15 minutes, but the biggest debacle that is happening in startup world is people actually go and find a solution first, and then they go all out with all money to find where the problem is. And that's the biggest misery, where the failures of startups is at a very high level. And within our startup, where we are at IIT Delhi, and I'm telling you my own personal story, and this concept came out of that, and then it's history because we won many awards in this, grants on this. And so I was mentioning earlier, I come from a family full of doctors, including my wife, and it happened during COVID. This concept actually emerged during COVID, and I used to get calls from my school friends, places where I've worked, that they want to talk to my parents. Now the point was that because for any cardio event or a nephro or even for any biopsy, they had gone to a private institute, and they were not sure whether the line of action was correct or not. And then they had approached me because my parents worked in a government setup, and they said, we want to reach out to doctors for an independent validation of what has been given in my opinion. And what happened, and till today I get this. So what I realized that, so what I did, I started aggregating. Listen to this very carefully. I started aggregating all the doctors who have retired from AIIMS, Maulana Safdarjung, wanted to build an Oberoi of telehealth only for second opinion. Now, when this thing happened, we got a lot of calls, and we simply an MVP. MVP stands for minimum viable product. That people started calling me and they started connecting me. We made some money out of it. But the major problem was something else, and that's what I'm going to talk, and it's related to your industry. When we went, I personally went, and as a startup, I'm sure all of them, most of you would be turning into an entrepreneur. I think I highly encourage. The time is right. Next 10 years are for India. I went to pharmacists outside AIIMS, and I said, why don't you sell second opinion to patients who are coming? That was one data point. I was standing outside AIIMS and see how concepts are found and how things are built. I realized when a patient walks up to a doctor, the doctor ratio, patient ratio already scored against patient. Doctor would get sufficient time for diagnosis and a treatment plan. I realized, large data point, n is equal to 100 outside AIIMS, 45 degrees I was standing with my team, myself. Patients walk out of AIIMS, they are in a state of helplessness, dilapidated, they are absolutely miserable. And when you walk up to them and said, Ki, bhai sahab, kya hua? Why are you such state? He said, bhai sahab, ye jo medical prescription diya hai, I have no idea what it means. What means is it, does BD stands for, what does TD stands for, whether it has to be taken with milk, without milk, empty stomach, what is dosage, duration. And this guy, if you just follow his journey, he walks up to a pharmacist and says, bhai sahab, ye parcha samjha do. And I started digging up articles. I'm saying this in public, I have no shame. I realized, and this is stat, 95% people behind pharmacy stores are not even 12th pass. And then I realized self-medication has become the biggest cause of mortality, is a very strong word, morbidity, poor compliance. And then a simple thing, I was standing outside AIIMS because we were, as I said, we are looking at non-invasive retinal images. I was standing outside the eye hospital, and in fact we were covered in media big time because I quoted this. There was a gentleman, father, who had actually come out of this eye hospital, and he was in state of despair. He said, bhai, man, I was out of pure empathy, I walked up to him, bhai sahab, hua kya? He said, I have an 8-year-old son, and he had gone to AIIMS, and this guy, exactly 3 months back, the doctor had given him a medicine. And this guy had put that medicine, कि उसने हर दिन डाल दी उसको. And this guy was putting, उसका दर्द, or every day he was putting that drop. And when he had gone to the doctor, उसका हिंदी में उसने बोला था कॉर्निया गल गया था. And when I looked at the prescription, doctor was not at fault at all, because that was an anti-inflammatory. I had to put, उसको दर्द, हर दिन दर्द हो रहा था उस लड़के को, बोलता कि उसके फादर को लग रहा था कि ठीक हो रहा है दर्द. Pharmacist had no clue, दे दिया. And then what happened, the son had lost his cornea, and then they are back, and this guy was from Agra, just 100 kilometers away from him. And then with this simple thing, like how you go to a bank for KYC, they don't give you your bank account unless you are KYC'd with your Aadhaar card. Within VaidyaRx, we launched, apart from second opinion and a trigger point from the pharmacist, we launched a simple product called KYP, Know Your Prescription. And we got it trademarked. And my vision is, trust me, we get lots of call every day from adolescent girls, geriatric population, who don't understand when to take medicine. They forget about the writing. My vision is in next 10 years, none of you guys should get medicines. You guys are doctors, but none of the patients should get medicines from a chemist until you are KYP'd. You will walk up to a chemist and say, are you KYP'd? Which means, do you really understand what you are getting? And if this situation was in US, it's a very different situation. They are highly paid and you get sued. And that led to germination of this whole concept called VaidyaRx, where we are building India's first Now you will understand the concept. Patient care, post-prescription care, follow-up care, digital health platform, where we are doing KYP, where you will be surprised to know, not surprised, I was surprised to know, to be honest, there are 10,000 pharmacy colleges in India, from Moga to Chennai. 10,000 pharmacy colleges in India. And imagine the power you guys have as B-Pharm, M-Pharm, PharmD to make people understand prescriptions. We spoke to a simple innovation. I'm again telling you, as a startup, power of observation is the ultimate thing. I was standing outside pharmacy store, again, irrespective of temperature, irrespective of my education. First of all, ego should never be there. I observed ladies would wait up outside pharmacy stores until all the male guys would go away. And still we are in 21st century, this is happening in Delhi. And I spoke to 100 adolescent girls. We realized that whatever happens during that age, intentionally, unintentionally, what body goes through, they would never talk to their mother, sister, forget about male pharmacist. Then we added a simple feature within an application. Application is live on Android. I would highly encourage you to download Vaidyarik. A simple thing like she support. No AI, no ML, no hi-fi words. You just press on she support. You only get to talk to a lady doctor. And I was surprised that all these unicorns means all these hi-fi companies like 1mg, they don't have this simple feature. And then we also added a vault that you can actually store your prescription for 3 years. Now, this again also came, I was telling one of your friends, to become successful in a startup, you have to have real conversations with real customers to get real evidence. I was talking to a gynecologist, although my parents and my wife, they're all doctors. And I said, I'm planning to have a vault, VALT means basically rakhne ka digital storage, for prescription, which aligns with National Digital Health Mission, all those fancy words. But do you really would need this? And you know what her answer was? This is 3 gynecologists, I'm summarizing it. She said, when can I download the app? Just digressing, when someone says, just give it to me, it means you are on the right track. And trust me, at that point, we just had an idea. App to bhi banna hai. 3-4 mahine hua, 4 mahine, and we launched it and we are doing phenomenally well. I'll tell you one more aspect. And this gynecologist, I asked her, always one lesson I will tell you in life, whenever you have to go deep, irrespective of your PhD or not, always ask 5 whys. Why, and you will get the answer. Never get stuck at one why. It's all superficial. Then I asked this gynecologist, why do you think you need this? Why? And she kept telling the story. The answer I got it after 5th why. She said, she gave an instance. Always go through the story that's going on and then you will know whether your product will fit in. She said, I have a small clinic and I was there at the clinic in Sultanpur, which is just offbeat IIT Delhi, just 3-4 kilometers away. He said, my patients walk up to me, I write prescription and they go away. Every second day, these ladies call me in a very humble way, she said, in a very nice way, that I am having some urine issue, I am having some giddiness, and I ask her, bhai khaya kya hai? First of all, उनका पर्चा उनका तो घूम गया होता है और घुमा नहीं होता, उनको पढ़ा नहीं जाता है तो वो guess मार रहे होते हैं. And the worst part, you know what? The doctor has no idea where she never keeps a copy of that prescription with her. Extremely sad. मतलब आप डॉक्टर ने दे दिया, आपको खुद ही नहीं पता कब लिया था, कौन सी दवाई, वो डॉक्टर को फोटो भेज रही है, वो गलत फोटो हो जाती है. एंड इमेजिन वी आर स्टिल वेरी फ्रेश. रात के 9 बजे, एंड माय पेरेंट्स आर डॉक्टर्स, आई नो कि मुझे इरिटेशन हो जाता है रात. इफ माय एम्प्लॉइज कॉल मी एट 9 when I have done all the talking since 6 o'clock in the morning, I get irritated. Imagine कि हाँ तुमने क्या दवाई ली पता नहीं, अच्छा यार पर्चा भेजो, मैम मिल नहीं रहा है, मुझे तो vomiting. That instances we realize that we need to have a vault where when a patient walks up to us, we click the prescription and the vault, the prescription gets stored in the doctor's database as well as patient's database. And the last point we did, that was the killer. And again, pure power of observation. We had 40-member team running. We hired interns from IIM Ahmedabad. I spent a lot of my own money because we had to get it right, because we knew that we are getting there. And the last part of the puzzle that we did was something extraordinarily surprising. When a patient, and it only happens in India, trust me, these are all India-centric problems. When the patient walks up to a doctor and doctor gives a prescription, forget about digital, or you will be surprised to know, might agree, but I'm telling you the ground reality. You go 10 kilometers away from where doctor sits, you will not get that medicine. I was stunned because I'm a privileged guy. I was literally born, brought up, raised in Ames campus. I never, in fact, look at medicine. Dad gives it to me, and I was like, really, aisa hota hai? And you scratch the surface. So, वो salt substitute चलिए जो भी है, but वो buy नहीं मिली. And then we figured out that if you have patient on the top, then doctor, then I started talking to the pharmacist in a different way. And there we realized that these pharmacists have another pain point. And that another pain point, जब आप किसी के pain को आप solve कर रहे हो ना, तो जब आप value दे रहे हो, see, the end of the day, startup is a fancy word, but it is nothing but a business. And the business means that you have to have people who are paying for what the service you are giving. And when you pay, then you figure out how you make profit out of it. But at least वहाँ तक तो पहुँचे. Problem है भी कि नहीं? As I made a flippant comment that people build a solution and then they go all out with all the money to find where the problem is, and then the problem starts there. So, and then we realized that pharmacists had another set of problem, that they are so annoyed with these online pharmacies that they feel, or whatever reality is, that the business has gone down. And then I realized that, these guys are frustrated, patients are frustrated that they are not getting it. So we thought, and we have a very strong team in terms of co-founding team, that if we connect, okay, just last point. So if we connect patients, doctors, so what we started doing, we started aggregating all the hyper-local and local pharmacists. So when a patient walks up to a doctor clicks the prescription, or he writes, we have a 2.5 lakh database, it goes to the patient after the consent of the patient. See, you have to go through all the guidelines of telemedicine guideline 2021, post-COVID it got accelerated, that the same prescription goes to a local pharmacist within 500 meters. So we acquired 2,000 pharmacists within Delhi NCR. So when the patient comes, it goes. And the patient has spent 1 hour with the doctor. He's already in a very tired state. So now he knows two things. First, this pharmacist will definitely have the medicine. Trust me, doctors are bombarded with only two people, MR and pharmacist. Let's be very open. And we have to address that problem. So the prescription goes to the pharmacist, 4 or 5 pharmacists. After patient consent, so democracy, he can go to anywhere, whatever he wants. He has the record. Patient knows that कि एक तो मेरे को मिलेगी दवाई, दूसरा salt इन पकड़ा देंगे, और दूसरी चीज की यार वहाँ पे जाके फिर से लाइन नहीं लगानी है, वो ready रखेगा. And the pharmacist is also eager के धंधा बढ़ गया. See, you have to understand in a startup, if all stakeholders are not happy, it's not going to move. Not at all. The pharmacist angle was that he got more revenue and more value out of it. Patients got KYP and second opinion. Doctors get more. So we are, actually I was telling that I would be coming to institute later on, because we have to collaborate with you guys to come and join us on KYP platform. For second opinion, we have kept a bar of more than 25 years experience. Otherwise you cannot become part of platform. Otherwise, why would I go to a young guy for second opinion? It's not going to work. It has to be retired doctors or 25 years or 30 years. So this is what we have built as a model. And so why I am in NIPER, or why I am here, is of course to share my journey and my learnings, and also how power of observation, how this problem of people not understanding prescription we have ignored for so long, either we do not demand it from doctor or we careless about pharmacist. Trust me, and these small issues like she support are so prominent, profound. Even in Delhi, I'm talking about. Girls even in Delhi do not want to talk to a male doctor. This is in Delhi 2022. And so my whole point was to see where we can work together. And I was telling your friend that we hired literally 10 interns from DIPSAR. It's very close to our IIT because we are working on AI applications for this, where if just 30 seconds I will take more. So one of the AI applications we are building, again, how if you have a problem solving mindset it happens. So we hired interns. These are very expensive. We hired interns from IIT Delhi, computer science, future Sundar Pichai guys. We are building on it. What we realize the problem is that when you go to a pharmacist, when you walk out of it, most of the people, you might disagree, are not sure कि भाई जो मांगा था वही दिया है. So what we do when you move out of pharmacist store, लेके so what we do in digital prescription, the digital prescription is part of VaidyaRx in the application. You just walk out of it, you click the photo of the medicine. Through OCR, simple technique, I'm sure you must have heard it. It picks up the name. We have a 2.5 lakh database medicine. It matches there with salt substitute. It matches with the prescription that we have in the app. And it says it's verified by VaidyaRx. And then star. To know more, do KYP, which is know your prescription, which we have trademarked now. And to be more sure, talk to your own doctor. Of course, you have to give those warnings because if it gives. So this is small AI things that we do. AI stands for artificial intelligence. We are simply using OCR and K-means method. And simple things become very significant in tier 2 and tier 3 cities. So there are many other things that we are working on. But I think my time is up. Thank you so much for listening to me. And I think, I would appreciate if you have any query or question related to concept or startup or how to start or how to get grant. I have been through everything. Literally started from minus 10 lakhs when I had loan, and then we have literally 5 crores of grants and many other fundings from government, private, purely on the strength of idea, with no guarantee whether it will work or not. But government is very supportive now. Yeah, your name and yeah, so that.
I am the chair of this session. Sorry I was late.
Okay.
All right. Yeah. I just wanted to ask one quick question. When you are handling all this data, you are storing many private data of many patients. What is the guarantee on data security that you offer? Have you taken insurance for data security?
So we haven't, great question. So data security has been on top of our mind. In fact, we have legal people who support us when we form our consent form. So from step 1, you have to be very correct. You have to understand all the policies where you have to take consent, because as per, I'm just digressing, as per all the rules for everyone, the data is now the sole property of the patient. No doctor, no pharmacist. But if you're taking consent, government says it's okay. Point number one.
You may take consent to hold the data, but you have to offer guarantees that the data will not be accessed by others.
Yes.
And how do you ensure it, and what kind of data sharing policies do you have, and what kind of insurance do you offer to the patients in case of data breach, which happens in the biggest of biggest corporations, by the way?
Yeah. So we have, so answer to that point, I was in fact very well said. In fact, coming to that, so in fact, Digital Health Program of India has appointed an authority which talks about all the encryption. So the leakage happens in 2 ways. One is in storage, when a brute force can enter and take out the data. So you have to ensure it's HIPAA compliant. So you take the best servers like Amazon or Digital, do not keep it into, and keep a redundant server, point number 1, with all the, and the second leakage happens during transfer. So you use the highest keys, encryption keys, that the data is not transferred to some other authority while it is being transferred. And the third thing is that in terms of insurance, we haven't done at this point, as we are still very early. And in fact, a couple of people did mention to me in other forums that if we can have that, but we'll try to incorporate that into our system. But very valid point. This has been the third time that someone has pointed, so I think I need to aggressively move into it. But in terms of consent, in terms of ethics, in terms of storage, in terms of transfer, where all the leakages happen, we are very, very thorough on that. And in terms of redundancy of server, in case anything happens to one server, then you always have to have another servers ready, and backup of the data. And you cannot ever see, I'm the platform where the doctors are on one side or the patients on the side, their medical record. So as a director of the company, anything goes wrong, I am behind bars. So it's very, very simple. It's, in fact, business has this risk. One has to be very, very careful. It's not easy as I was sounding. One has to be very, very careful. So as a director, as board of members, others, we have to be very careful on how we are storing data and the data security, and keep checking the guidelines which are there in US and Europe, so that we, although this is very India-centric at this point. Yeah. So very valid question. Excellent question. Yeah.
Hi, yeah, I'm Vijit. So
Okay.
yeah, fantastic. I mean, with, I have elderly parents, so I
Okay.
really kind of understand the issue.
Yes.
And my dad lost, his cornea just because of that, the kind of issue that you said. So I have three questions. One, I think already covered by that one, by this legal issue. Second is that, so you are talking about the second opinion, right?
Yeah.
In our day-to-day experience, we know that every time we go to a second doctor, he or she negates the first prescription altogether. So how do you kind of handle that?
Brilliant.
My second question is that now I understood that you got the grant from different agencies as well as the government, but like what is your revenue model in the long term?
Okay.
And my third question is that again, so because as you are working in this area and you said you take the patient consent, but a patient who cannot really understand the prescription, do they really also understand the meaning of the consent? Thank you.
Oh, okay. Excellent. So answering to your first question, first of all, sorry to hear about your father. I think it's very sad, and these instances are actually happening across the country, and that's why I kept saying this is very India-centric.
He is educated, I am educated, still that.
Yeah, and these are, in fact, offline I will tell you more instances that will put you in a shock, especially what happens with ladies, and when they do not get to talk to they never go and talk to a male pharmacist. That's also a big, big issue which has largely been unaddressed, and I urge all these young ladies to take up that issue seriously. But coming to your question about second opinion, so in fact, when we were building this concept, as I was, I don't know, so in the starting I told this came out of purely my own experience, where my friends used to urge me politely that can I speak to my father, he's from AIMS, and my mom is an oncologist, my wife is a dentist. For simple things like ये RCT होना है, ये plant होना है, करवाऊँ नहीं करवाऊँ. To my mom, that they would come and we stayed in AIMS Hamburg, वो घर ही आ जाते हैं कि ये biopsy बोल दी है, कराएं. And I used to see that when my mom would, with all empathy, she retired from Shabdajang, but that she would see, and then you would see a smiling face, and they would offer money as well, but of course parents would not take, but they will go. So I realized, and when I started speaking to people, they realized that money is never an issue. It's, can we get an independent, unbiased opinion? So then we started approaching lawyers. How do we do it? How is it happening in US? So it clearly came out that when you write a second opinion form or legally, it has to clearly say it is nothing to do with the first opinion. Your first opinion stays as it is. It is just an opinion on the reports of what, be it a radiological report, MRI or scan, which a doctor is giving, and it has no overbearing on your first opinion. They have to tick it. And the doctors clearly in a website, it clearly says that. And this is just an opinion which is, and the first, so we actually got it drafted from lawyer and got it approved from few AIMS doctors, whether it is and we saw how it's practiced in US. So we ensure that, and touch wood, it has not, no one has sued us at this point. So yes, some people, the challenge is that we keep a 15-minute slot, people keep going for half an hour, 1 hour. That's a technological issue. For second opinion, they sometimes say, no, we want to talk one more time for the same cost. So those challenges we keep facing. For some, they said, we want to also have another opinion from the same platform with another doctor, be it third, 10th opinion. So second opinion is just a term, but it's just multiple opinion. But we clearly put it in a form. And the third question is the revenue part. Very nice question. So we have three stakeholders, sir. So one is patients, the other is doctors on the left side, and the pharmacist. So for the patient, we have kept subscription model where we charge at this point, we're changing now the pricing, like 100 rupees for 20 KYPs, 800 for 20 KYP. KYP is know your prescription, and 2 second opinion, which is just a scheme. Later on, they have to actually see from the portal what the doctor is asking. For the doctors, for young people, KYP, they have become money for, because people pay, doctors earn more revenue through second opinion, and we take a convenience fee out of that. And the biggest one that we are seeing actually is, you'll be surprised to know, I'm glad you asked that, I'm going into depth now since you have more time. Average prescription value of a customer in Delhi NCR we saw and needed is 450 rupees. 450 rupees. And for medical supplies like BP machine, wheelchairs, it's 1200 rupees. Now, what we do, when we realize that these OTC drugs, the margin they make is close to 15 to 20%. And for medical supplies, the margin that pharmacist makes on the ground is 30 to 40%. So what we have done, for example, 100 patients, and now I'm telling you exactly how things happen. 100 patients ordering through 100 pharmacists into 450 is 45 lakh rupees, let's say, in a day. But that's not our revenue. At this point, we are going very, very low because it's an MVP. We have just launched 4 or 5 months. We are signing a deal of that 15% margin, they will give us 3%. Out of that medical supply, they will give us 7%. So 45 lakh is the gross margin per day of the revenue that Vidyaris will make. 100 patients into 100 into 450. I'm just giving it for, it's not the real figure. That 3% is our revenue or the money we make. So 3 points we make. Yeah. No, absolutely. Yeah. Thank you, sir.
Thank you so much, sir. It was really inspiring, but the time is a big limitation out here. So we have to go ahead. We are very fortunate to have our chairperson, Dr. S. Anantha Ramakrishna, CSIO. I'll just introduce about him because he is a part of this technical session. Professor S. Anantha Ramakrishna, he received his MSc Integrated 5 years degree in Physics from IIT Kanpur in 1995 and PhD degree from Raman Research Institute, Bangalore in 2001. He worked on the theoretical aspects of light propagation in the random media, including temporal signatures of Anderson localization during his PhD. and was supervised by late Professor N. Kumar. After working as a postdoctoral researcher with Sir John at Imperial College London, he joined IIT Kanpur as an assistant professor in 2003 and became a professor in 2012. So Professor Ramakrishna has worked in the area of metamaterials and nanostructured materials and has published over 115 papers in the refereed international journals, about 70 papers in the conferences, and research monograph entitled, that is, Physics and Applications of Negative Refractive Index Materials. He works on metamaterials and has drawn enormous attention from the scientific community and have been highly cited. He has been awarded S.S. Bhatnagar Prize in 2016 by CSIR India, and that is fellowship, by the Department of Science and Technology India. He joined CSIR as a director on 27 July 2020 on leave from IIT Kanpur. Currently, his research interests include technological application of metamaterials and plasmonics. So we request, sir, we request ma'am and sir to please first we'll just present a memento to our first speaker. So please kindly the chair and the co-chair, yeah, please present the memento to sir. May I please again request co-chair to please present the bouquet and the memento to the chair. Please. Yeah. Thank you so much, sir. We are moving with technical session 10. This lecture 2 will go on now. Sir, please can you introduce the second speaker?
Thank you. So today we have with us Mr. Arun Prajapati. He is a bioinformatician from Ajmer, Rajasthan. He is a biotechnologist and obtained his master's degree from D.Y. Patil Biotechnology and Bioinformatics Institute, Pune. He has interested experience in data analytics, bioinformatics, drug discovery, drug development, NGS, pharmaceutical and molecular biology. He has served as content developer and data analyst in My Genome Box in Pune, and he has worked as a research intern in Grodia Technologies Private Limited and Indian Institute of Technology, IIT Delhi. He is presently working as a senior bioinformatics scientist in Grodia Technologies Private Limited in Gurugram.
Hello.
So Mr. Prajapati, please.
Sure. Hello. Yeah, good morning everyone. I just first thank you sir for the great introduction. So we'll start the today's session, that is startup opportunities and challenges. So I'll just start with the first line, that if you believe in startup will return the favor, whether it's your own startup or somebody else. Why I'm talking about somebody else? Because the company I'm representing, it's not my company, I'm not the founder, but I was the first employee of this company, Gloria Technologies. So I'll just share, I don't have this much of experience that Mr. Tarun sir just had said. I'm just this much, not have so much stories. Why would I think that? But there are difficulties when I joined this startups. The first difficulty when I joined for this startup was the family pressure. The first question the family asks is whether they are going to pay or not. It's a proper job security or not. But because I was already associated with the director of this company, I have done my internship. I went for the dissertation project in IIT Delhi, but due to some COVID reasons, it became an internship as not the dissertation project. So I convinced my family, let's just give it a try. I know my sir's capability. I believe in him, and today I'm here representing his company on behalf of him. So it's been like 2 years I'm associated with this company. First, I'll begin with the company profile. Then I'll just come back to the startup opportunities and challenges, what I think, because I have a different perspective as compared to the founders. So first, I'll start with the name, that is Gloria. Gloria here stands for the growth and idea. Now, it's not working. Yes. So here we will start with the vision, what we are looking for, and mission, what is our target. So for the vision, we want to provide computational biology techniques to the larger scientific community. And for the mission, we want to improve the accuracy of the drug discovery. By improving the accuracy, I mean in silico techniques, with the help of in silico techniques, we can screen large numbers of molecules as compared to our traditional method, which is a wet lab technique. So here are the 4 verticals of our companies, which is first is small molecule discovery, second is protein designing, genomics data analysis, and fourth one is the data analytics and secondary research. Now it is a little background of our company, who we are. We are totally a computational life science company and data analytics. Company started in 2018 in IIT Delhi. Then these are our expertise we provide, that is in silico life science, data analysis, AI ML application, and we also do application tool development. These applications are totally based on healthcare. Then these are the pipelines we categorize our work into. First is for the molecule discovery, second is data analytic platform, third is secondary research. Now it's a small team right now we have, but this is a dedicated team. Here is our director, Dr. Avinash Mishra. Due to some reasons he is not here. Now the company is started under the mentorship of Professor Anurag Rathod from IIT Delhi. Now these are the key elements of our offerings, like how we differentiate from the other companies within the same domain. The first is for the ML based discovery. Like we used AI ML techniques to improve the accuracy as well as finding, it is a major step in the molecule drug discovery pipeline. Then we go for the in silico simulation. The in silico simulation is for the in-depth analysis of our complexes. Then there is fast and accurate properties prediction, which can be done for our compounds, for our library. Now it is our first vertical, that is compound design. Now here the compound design has like 4 components. First, that is drug repositioning, new chemical entity, fragment combination, and peptide organopeptide designing. These 4 components depend on the client's requirement. Then we started molecule discovery with the pre-molecule discovery. First is the selection of drug target. How we are going to select our drug target? It has 4 steps. First is the structure selection. You can just download it from the web. Then you have to, these 2 steps are the most important, which is finding the functional residues. Whether the region you are targeting, is it functional or not. Then after finding that functional region, you have to select the binding pocket. You have to make a pocket around it. Then there is a druggability score, because not every binding pocket has is druggable. It can't be, because after research you will get to know that this site is not druggable, then it is of no use. You just wasted your 1 or 2 years in the research. Then here after getting our drug target, we will move to the compound library creation. The library, the compounds which are going to target based on that drug target or the disease we are looking for, the scaffold we want to procure, or it is also depends on the physicochemical properties. So these are the steps for the compound library. Compound library can be created like with the free publicly available sources as well as paid source. Then after getting the drug target as well, we have our compound library. We go for the protein ligand interaction. Here we follow the standard protocol, which is blind docking, targeted docking. for finding out the best fit and the best conformation for our protein as well as ligand. Then we go for the scoring function. Here scoring function plays a major role as it categorizes our poses into rank our poses. Then we cover the molecular interaction, the images we look for the 3D images, 2D images, finding out the residues we want that are interacting or not, or how are they behaving after the docking. Then there is a, on top of it there we have a deep neural network and convolutional neural network to find out the efficacy, affinity of our drugs complexes. Then we have to done the molecular dynamic simulation to find out the conformational characteristics in depth analysis. It can be varied from 100 nanosecond to 1000 nanosecond. 100 nanosecond is the basic or minimum simulation we run, because nowadays even 50 nanosecond simulations are not accepting in the manuscripts. So these are the different variable simulation we run, that is structural variability, membrane protein, NN sampling, MMPVSA calculation, and the steered MD. Now here is the case study. The first case study is AI based efficient toxicity prediction. The case study I am going to show you in this presentation are in-house research. We are the sole proprietorship of it, and all are published in international peer reviewed journals. So the first case study, AI based efficient toxicity prediction. Here we have find out the toxicity of a particular library using the AI ML methods. Then here is the second case study. As the name suggests, DPP4 inhibitor design. Here we have designed an inhibitor for the DPP4, which is a critical target for diabetes. So we have tested our designed few inhibitors for the DPP4 and later we have validated it in the experiment also. Then we come for the, like, if there is a COVID phase, we have to do research on COVID. That's the basic necessity for now. So we have found natural compounds towards inhibition of SARS-CoV-2 protease. Here we have found a synergistic effect. When we are using two compounds simultaneously, they are just increasing the inhibition activity. It is also proven experimentally later. Then we move to the antibody or peptide design. It is also just same as ligand and protein. Here we use the protein-protein or protein peptide. So in this pipeline, the first phase is for antibody modeling, hotspot identification. Again, antibody modeling is generating a model, creating a model, downloading a model. Hotspot identification is the binding region. Then we do the docking, and again for the in-depth analysis of molecular dynamic simulation. Our every process go through the molecular dynamic simulation to prove or to neglect any temperature, pressure effects. Then this is the second phase. It is more based on the post-analysis of MD simulation, which is MMPVSA energy calculation, the residue contributions. We generate the multiple CDR regions. Then docking and MD simulation by comparing it to the reference molecule or wild type. And suppose if we don't have the model structure, already we don't have the structure on web. So we can also design or model the structure by using the framework selection, orientation of variable heavy and variable light chains. Then we can also go for the CDR modeling, that is complementary determining regions. Then our energy minimization by minimizing the optimum structure. Then now till now which I have told you is on the biophysical side. Now we move to the AI based structure guided design. In the AI there are three steps we generally follow. First is a stellar graph method, which is a Python based ML method. In this we extract features of the antibody and antigens. Then we build a model, train and test set, divide them into 30:70. Then we validate the docked complexes based on that train and test set. Then again here is the AI based sequence guided design. Hello. Yeah, AI based sequence guided design. In this, suppose if we don't have the structure, we can't model it, we can also go through the amino acid sequences. First is the sequence identification. Then there is a data conversion, which is one hot encoding. It is the language of computer which converts the data into 1 and 0 format. Then it is through the deep neural network we predict the sequence modification where the binding site or the region which is helpful for us for the finding of the binding affinity. Then again here is the molecular dynamic simulation for the protein peptide docking. we generally use do the equilibration. Then there is a minimum of 500 nanosecond simulation. Then there is a principal component analysis to make it simpler, then MMGBSA and clustering. Clustering is done because if we are running a 500 nanosecond simulation, we are capturing at every 2 picosecond every conformation. It is very hard to find out which conformation is going to be suitable for us. We just cluster a particular region like from 400 nanosecond to 500 nanosecond, which is the stable one. Then we go for the middle cluster, which is the more appropriate cluster or more appropriate conformation we are going to use for our further studies. Then there is also an aggregation study to know about a protein where there is an aggregation or dimer formation. For the aggregation study, we also have a case study, which is insulin aggregation. Here we have designed a peptide to inhibit the insulin aggregation. In this case study was also experimentally proven later. Then there is another case study of trastuzumab. Trastuzumab is a breast cancer and stomach cancer targeting monoclonal antibody. And in this we have find out the CDR regions first. These CDR regions are checked, then these light chains and heavy chains are checked for the immunogenic regions, if these regions lie in the CDR or not. And if yes, we just made mutations in these regions, then do docking, then do simulation and find out the humanness score of our complexes, which is a better result and it improves the humanness score of the trastuzumab after the simulation. Then these are the success stories of our company. In the scientific services, we have provide service to the academia, pharma companies, private companies, as well as some international NGOs. And for the search and analytics, we have served secondary research company, IP and IPR companies, also some private companies. As I already mentioned that we are totally a service-based company. We do not take any priority of the service offered. We provide 100% data security, and we are best in post-service assistance. Then this third vertical, genomics, which we have just entered into this field like a month or 2 ago. First is the whole exome sequencing analysis, which follows these 3 steps. First target enrichment, then the sequencing DNA, then DNA sequencing analysis or annotation. Then there is a RNA sequencing data analysis, which is also based on these 3 steps. And here is the amplicon sequencing metagenomics, which targeting metagenomics data analysis as well as shotgun metagenomics analysis. Actually, I don't belong to this genomics field, that's why I'm not explaining much. I am also learning these things right now. So here is our company, Grodia. We are situated at Gurgaon for now. And I just want to thank everybody for listening me. Please have a look at our website, that is grodiatech.com. If you have any query after that, you can contact us directly through this given number, or you can also mail us. So that's it for the Grodia. Now I will talk about our today's session, which is startup opportunities and challenges. For the opportunities, I don't think any idea is too small. If you have the capability, you have that skills, that people should hire you, pay you to do that, to do that task. So you should give it a thought. And the other thing, what opportunities startup can provide. You have a live example of me. Today I am sharing the stage with Tarun, Dr. Arnab, Mr. Ramakrishnan. That is because I don't have that experience, I can say that. These guys are legends in their field. I am just starting, I am just at the first step. But today I am here representing that. So because you also need someone to do your work. If you will start your company, you will need your first employee who should believe in you. So that's my perspective for the today's thought. That is startup opportunities and challenges. For the challenges, there is only 1 or 2 challenges, I think. First is the customer's need, which we also get to know in the yesterday's session by Sanjeev Gupta, which tells us about the user's need. And the second is the customer's trust. When we are saying like we are providing 100% data security. This thing I will say I will provide 100% data security, and Tarun sir will say he will provide 100% data security. No one is going to believe me as compared to him, because we are just starting. I'll just explain him everything, like I have this framework, I have this firewall, I have this server, this is this much protected. But the trust, you have to convince your customers. That's the first and the last step. If you will just get your customers right, then you can do everything and you can run your startup. So that's it for today. I hope everybody liked it. Yeah, if you have any questions.
Question here is very technical. What do you think is your biggest fear while working for or working with startup? Biggest fear?
My biggest fear is, like, I don't see any fear. I just see the opportunity that after 5 or 6 years, I'll go to that position. For me, a position matters as compared to the money. I want to achieve that position first. Money is not important. I don't fear anything. Like you already told, we are at much privileged कि we can work for a little pay as compared to the others. And the biggest opportunity is also mentioned that if I work for a MNC, I'll just stick to a particular job role. I will not get that exposure which I am getting. Even I can ask you whether you thought you will be explaining retina, you will be learning about retina after doing your civil engineering. That's the exposure you will get in the startup. The idea, the thing you have to work for.
So, your part of AI that you do, what do you use? Do you use online tools or you have your own proprietary software?
No, we make softwares for the according to the client. What it's a requirement, what properties they want to predict. So we make for them, and no online softwares.
You're not using anything like Google TensorFlow or something?
No. We make our programs on Jupyter, and we just give the proprietary to the client.
Okay, so you have a set of AI programmers and so on with you?
Like it's right now the concept is done by me, what properties and something, and the AI is designed by our director.
Yeah, that was a wonderful talk. And my question to you is, when you are talking about target identification using AI, so how different it is from the routine comparative genomics and other studies that we use for identification of drug targets for any diseases, whether infectious or non-infectious?
So when we we'll select a particular target which is the similar one, most aligned. We go with that residues, we make a binding pocket according to it. But in the AIML, we used every possible approved drug, clinical trial drugs, which is targeting that area, or which area they are targeting. So it will help us in getting the more binding pockets, as well as it will help us to get the druggability score, which pocket is going to be useful for us.
So what is your comment on this, like the targets that you identify or the pockets that you identify using AI, how well does it go well coordinate, or the data coincides with the in vitro studies?
Yes, so like recently we have a study where we are finding an inhibitor, because in silico you can't tell whether this is an active site, but what effect will it provide in the wet labs. So we are finding an inhibitor, but instead of inhibitor we found an aggregator. Our ligand go and bind to that exact position we are targeting, but it has become an aggregator. So that is also a study, and it gives us commendable results, which we are going to patent. The company's client is going to patent for it, and we are getting the innovator designation for that.
So what is your take on it? Like, what I feel is not all the compounds that you identify using these in silico tools or the AI tools that you're talking about actually work in the in vitro system.
No, like they
So
are
what is
helping
the
us. That's why
percentage?
we are using the in silico.
Yeah.
Even right now, the government is also looking to cancel out the animal study based on their in silico results with the proper regulations and all. If you have a proper standard, you can neglect the animal study and directly go for the trials. So somewhere in silico is helping. It's just based on your protocols and standards, whether you are following a proper tools and proper thing. If you you are finding out the desired result or not.
Yeah, what is the success rate? Like
Yes.
the
So
the
I'll
tools
just
which
say,
you're
like
using- Yeah.
out of 100,000 molecules, we designed 4 peptides for our customer in Australia, out of which 2 are going to be patented very soon. They have cleared the documentation and all. Now they are in the patenting stage. So we are very what should I say, firm belief in our algorithms. And right now our director is not here because he is presenting a poster in Bates Pilani, Goa, there is another conference going for the International Conference of Drug Delivery, where we have give a better results than the Schrodinger suit. He is presenting that poster there.
Yeah, that was my actually query. Like when you say better, how better?
Yes.
How much variation? Like what is the upper hand? Like when we use AI tools for this, like so how is it better than the non-AI tools that are being currently used?
Sorry, I'm not getting you. Can I get back to you?
Yeah, sure.
How better? So you have built your AI tools, right?
Yes.
So ma'am is asking that non-AI tools and their standard protocols that still exist.
Yes, so that will help us to find out the virtual screening, which is the basic step, where we find out 100,000 molecules. We train our model on that. So that's the help of AI tools, because even which helps us to it already learn itself, which is the basic use of AI and ML. So on that train and test set, we are able to find out the most appropriate binding pockets.
Thanks a lot.
Thank you everyone.
Thank you, sir, for your nice talk. And I just want to know, when we work in our labs and we identify some drug or vaccine candidates, like whatever we want, at that time we use the in silico techniques based on the online available tools.
Yes.
And you were saying that you are using the AI-based techniques and which you have developed in your company. So if we want to identify drug or vaccine target, and we will give you the any genome sequence or something else, and we want just 4 to 5 drug target. So at that condition, we have already done something, and you will give us another data. So at that condition, you give all the data sheets which you have used based on your AI-based data sheets.
Yes, the first step is in silico, then we go to the wet lab.
Okay, but
That's
exactly.
Yes, and you
whatever
want to
you
prove
data
your result is right or not.
Yeah.
So it depends what we get, what is the analysis of the simulation and all, because
is there any facility in your company that we can go to your company and collaborate with you, and
yes, we are doing that.
Yes,
we are doing the academic researches where we provide them the results, give them the manuscript as well as.
Any collaboration is not possible in with your company, like we
Yes, every collaboration is possible. That's why we are having these conferences.
She's trying to ask that if the student wants to come and do the research at your place, is that possible?
Yeah, like we provide internships, we take 2 interns every year.
Okay.
After that, whatever your company has developed the softwares, we have the access for this? No.
No, it depends. If you are working on some client's project, so he has the total proprietorship of that.
Okay, thank you.
Yes.
Hello, I'm audible?
Yes.
I just want to ask that you are doing simulation for new molecular drug discovery, right? It is a long process, 10 to 15 years of industrial input and then clinical, right?
Yes.
And most of the drug candidates, they didn't pass the third phase because the stimulation cannot predict the side effects, associated side effects, which are detected in the later stages. So how AI can help that?
So we are not using the AI in the simulation right now. We are using for the screening, but with the help of AI, we want to do that simulation step where we put every single command. We prepare ligand differently, we prepare protein, we give different temperatures. We want to make a tool on behalf of GROMAX, where we just put our ligand separately, our protein separately, gives the temperature, and it will give us the final result.
No, there may be some input that this kind of a factor can induce kidney disorder or liver disorder in the later stages. So you are taking that point of consideration in the initial stages of screening or not? Because that will not help the industry in the later stages.
That will be studied after having the results, and like what is the mutations after having that kidney result, because if you are saying if you already suffering from any disease, there will be some mutations, so that will affect it, and that's how you will compare you will have references, you will have reference and you will have a mutant type. Then you compare the analysis, you done the analysis RMSD, RMSF, and see what is happening there.
please request chair and co-chair to please present the memento to the speaker.
Yeah. Now it's my pleasure and privilege to introduce Mr. Radhakrishna Mullapudi. He is presently working as Managing Director and at PHARMACON Laboratories in Hyderabad.
Hello. Check.
He is doctorate in pharmaceutical sciences from BITS Pilani. He served as a senior research associate in Biocom Bristol, Myers Squibb Research Center in Bengaluru. He also served as senior research scientist in Advenus Therapeutics in Bengaluru. Would like to use this?
Yeah, no problem.
He has a good experience as a principal scientist of ADME CRO laboratory with the top expertise in preclinical formulation in vitro and in vivo DMPK research and drug metabolism. He's a certified by Certara as a NCA analyst. So I welcome you to deliver your lecture.
Thank you so much.
Because there's some other meeting I have to rush to, I'll be moving in between your talk. I hope you don't mind.
No problem. Thank you. Go ahead, please. Good morning, everybody. Good morning. Okay, all right. So, how many of you want to become entrepreneurs? How many are there? How many want to start a bio-entrepreneurship right now or future? So do you have any idea about what is bio-entrepreneurship? What is the difference between normal startup and bio startup? Any idea? Okay, I'll go through the details. What is bio-entrepreneurship and what I am doing and how I achieved there. So we'll start. So basically, to start a bio-entrepreneurship, you require a different mindset all the time. See, the normal startup is something, you can develop a product and you can sell somebody else. But bio startup is something that you need to put your science and your mind and your business. Two concepts together, it will become a bio-entrepreneurship. So before starting any bio-entrepreneurship, you need to understand that you need to have a good infrastructure, good team, or good atmosphere, conductive atmosphere, or very good instrumentation, at least from basics to advanced instrumentation at where you want to start a startup. So apart from that, you need to know what is your business model. And business model in the sense, bio-entrepreneurship business model is different and normal startup business model is different. You need to understand the differences both. Then you have to do the marketing strategy, and also you need to learn accounting. Being a scientist, you might not know what is accounting, maybe marketing strategies. So before starting any bio-entrepreneurship, you need to have this kind of knowledge. So, entrepreneurship is nothing but sustainable, profitable business. Rest is a derivative of all those things. Any business you need to justify with the consumption of resource with your profits. If you conduct any experiment, what happens? You need a lot of resources. You will spend a lot of money and all. So end of the experiment, maybe you may not get result. So you need to plan very judiciously. Otherwise, you end up in the bad results. So any bio startup, I'll tell you truth, it is a risky business. So you need to know before starting any bio startup, you need to have a lot of resources, you need to talk to the people and, get out from your building and go and talk to the people. You need to develop a minimal viable product. So you need to have a lot of, knowledge before starting your, where you want to venture into the particular area. So when you come to the bio startup, you have different stages of your startup. So the first startup, when you get an idea, maybe you not be having a money, maybe no employees, nothing, only you are alone. So that is the early stage. From there you need to, graduate to next stage. So this is very challenging. This initial stage is very challenging. There you need to understand your expertise and your team and So maybe your idea is good. Maybe you may not have a money, funding resource, and maybe you not have a good team. There you need to build a good co-founder, good team, and you always have a cash flow negative in the first stage. So there you need to concentrate where you need to get a funds for your startup. That is very important thing. Once you failed at first step, the rest is, it's very difficult. So at the mid stage, what you see is a growth phase. There, once your prototype is ready, then your product, starts to go to the production. So there you require, a good amount of money, and there you need to discover the customer. So once you discover the customer, you need a more fundings. So from where you get a fundings, maybe venture capitalist banks, and you have to go to. Then once you discover the customer, then you have to go. Then your startup goes to the next level, third stage. There your product should be viable. There you get a cash flow from your marketing. So here your idea should be doable, scalable, and sustainable. Otherwise, if you don't have these characters in your idea, then your idea will not go ahead. So this is the life science startup entire life cycle. So there you see the as a founder, you need to you have to form the team. Then advisors are required. Then risk reduction. All the time you need to every stage you need to focus on risk reduction. Otherwise, it's very difficult to pass on next step. So at the same time, see all the parameters you need to work on parallelly. So at this, once risk mitigation is done, then you need to be your idea should be protective, IP protective. Then once a patent is raised, and you should go to the fundraising. Then again after that you need to go for risk reduction. After that it depends on the board of directors how they execute the idea and all. This is the entire life cycle for the startups. Here I need to discuss here that how many are PhD students here? Okay. How many your idea needs to be turned into the enterprise? So entire 5 years of your PhD should be enterprise. Should think in that way. So once you start thinking that way, you start working on your startups. Your 5 years of your PhD or 3 to 5 years should be a business model. Whatever field you are there. So whether you are developing a kind of what you call product or maybe some chemistry scheme, whatever it is. It's a patentable and it should be enterprise. Then you will understand a lot of things. Once you start thinking that way, you understand all these factors. All these factors are associated with your startup. So first you see PhD is basically what is you are identifying some cause and working towards that. So that is an unmet challenge. So once you are ready with unmet challenge, that is your idea. So then you have to build a quality team around that. Then you need to go and talk to the people. So always you remember, any startup, you go and talk to the people. This is the first mantra. So sitting inside the room, no, that doesn't work at all. First go and talk, whatever it is. So if I go and talk to the madam, then I'll get some information. That's the main important. Then understand the incentives providing by the government and the local bodies. Then you gain from, benefits from incentives. And that drive your, idea or company or startup. In the startup, always you see the scarcity of money. Always startup means scarcity of money. Mentally you fix it. Nobody will give you, free of money. So you need to search yourself, to take it to next level. You have to go every corner, discuss about your idea. You should discuss about your idea with the IP protection. You should know how to discuss with your idea. You cannot open everything and discuss with anybody. So then once you get a money, so stakeholders will come into your picture. So you respect investors. You always listen to the investors, what they say, and listen to their ideas also. Vice versa, even they'll respect your ideas. These are the main traits to, success your startup. So, see, initially what happens, you will be focused in one area. So your cash flow will be very little. Then you explore to the other areas where your application fit into the other areas. That's very important, at the mid stage of your startup. Identify the risks and use your time. In the startup, time is very, very important. Once you lose the time, your money gone. Very, very important, time and risk mitigation. Otherwise, you end up in somewhere else. How do you do risk mitigation? It depends on your idea and your environment. And test and build your business model is required. No. See, any startup business model is, I would say, not required. It's especially by entrepreneurship. So, more or less, the idea, once you progress is, then all the business models automatically will come to your board. So, either one more thing, you require a businessman into your board or not? No, generally not required. So why it is not required in the sense? So your bio-entrepreneurship is completely different than normal, enterprise. So here scientist doing a business is something is different. That science come business, you need to develop such kind of mind. Then you can venture into the bio-entrepreneurship. Generally, if you venture into the bio-entrepreneurship, there is a lot of checkpoints are there, regulatory wise and resources wise, all those things. So all the time, any startup should be lean in the sense very conservative. Whenever you require, take out the money and use it. Simply just like that, we have a lot of fun and just go and buy the fancy things. It does not require at all. When you execute the experiment, you should know that what are the materials you are using in each part, what are the costs involved. So all the due diligence should be required. Then only you can get a success in terms of funds and in terms of execution of the experiment. Otherwise, this is very difficult. And finally, don't give up on your idea. Problems will come, and you have to face it. That is where you learn. And one more thing I'll tell you. If you get a chance to work in the startup, just blindly go and take. Why I'll tell you? Because startup, you learn, you will get to know many things from scratch. So if you go to MNC, what happens? You're dedicated to particular field. So what happens? You only learn that field and you'll continue your career. But here startup, you will learn accounting, you will learn, people management, money management, vendor management, all those things. So end of the day, startup journey is a roller coaster. One day you go up just like that, next day will fall. Definitely, you see these kind of mindset. So you always, train your mind that, these possible failures, possible success always be there. And what is PHARMACON? That's a general startup what I faced before starting this. So PHARMACON is basically drug discovery solution service company. So this startup came out of my PhD. So this is my address. We are based at Hyderabad BITS Pilani campus, TBI. So what we do is that, overall biology activities and drug discovery. So from chemistry, DMPK, preclinical, what you call simulations, DDA interactions, up to phase 1, we do all the services. So my idea is that, our team idea is that to conduct all these experiments, what happens, you require a lot of resources, lot of infrastructure, capex is required. So what we thought is that, so we have a TBAs, bio-TBAs, TBA associated with animal house, associated with chemistry lab. So what we do, we go and utilize their labs and we develop resources. So that is where you cut down your cost and you develop the product. So this is general drug discovery pipeline which you all know, PhD students and masters. So what we do is that in vitro ADME, DMPK analysis, safety assessment, and pharmacology and PROTAC analysis. So different services we will provide to the various clients. Currently we have 2 MNC clients collaborated with PHARMACON. So we are working with them. So all what are the different services involved in vitro ADME, DMPK, bioanalysis, safety assessment, pharmacology. So these are the overall services we provide to the client. So we have a TAT time for 5 days. So we are thinking how to reduce 5 days to 3 days by using different technologies. So there is so many softwares out there we are validating. So generally one compound get the data from getting into the company, then generating the complete data, it takes 5 days for us with the entire drug discovery. So we are thinking to reduce it to 3 days. So we have we have generated the infrastructure. Recently we awarded it with a 5 crores fund. So we have all of this infrastructure. So our core values is quick and quality, understanding, integrity, creativity, and knowledge. So as a scientist, all this 5 traits is required to get a good data. So any organization, bioentrepreneurship is, to run a bioentrepreneurship, you require a minimum basic accreditations from the government, local government, DSRA, NABL, DCA, IAC, IBC, DP. These all this, without this you cannot run any bioentrepreneurship, whether it is startup or big company. These are the main things you require. That's all about my company. So I'm here. I'm based at Hyderabad. You can mail me whatever things you want. Any questions?
Sir, like there are guidelines for everything because you're involved in drug discovery and all. So I just want to ask if we want to enter clinical trials or something like that. So before that, there must be some checkpoints, right? That needs to be completed to file a new investigational drug application. So is there any like written document, like for IAC we have OCED and other guidelines. So for that, do we have any documented list or guidelines?
See, any clinical trial you want to conduct in India, you need to take a permissions from government. The different bodies are there, CGTM, this thing, CEDISCO, CEDISCO Government of India. From there, you need to apply. So they'll give permission, then you need to.
No, so before that, for that application purpose, I'm saying, so what we need, what things we need to have been like completed to
You're asking a data which supports to the.
Yes, yes.
So see,
like DMPK studies, they say, but like what exactly in that we require? Is there any documented?
See, I'll tell you, the drug discovery flow is like this. Once you synthesize the compound, you require the animal data, all the species animal data you required, okay? Then toxicity data especially. So based on the toxicity data, they project human dose projection. Then they'll test in phase 1 trials. So that's the data you required it.
Okay, thank you.
So could you touch upon equity dilution?
Yeah, good question. So equity dilution is, again, is a between the parties. See, how do you explain? Equity dilution is, somewhere, depends on your founder especially. Your idea is big, then you have to negotiate how you want to, go about it. So nothing, there is a principle for that and how much you need to dilute and all. It depends on you and a party.
So I have a quick. Hello. So in terms of clinical trial, do you think India has got some strengths? Because I keep getting requests from large companies in the US that they want to come to India for clinical trial, but when you ask them offline that what's the reason, so they say that the patients are high and you get the data easily. So does it mean that the ethics are compromised in India and data quality is not very high for others to take us seriously?
It's again debatable question. So earlier it was there, that 1 or 2 incidents it happened, to be frank. Based on that, these questions are arising. Now, CDSCO has tightened up all the regulations. So recently, Syngene has started a human pharmacology site in Bangalore. It's a completely, clinical trial site. So recently they have started it. So having said that, CDSCO has tightened all the rules and regulations to conduct the clinical trials. But the dent that happened earlier with its different companies, that still is existing in the market. That's why these questions are rising from the other countries. Any other questions from startup challenges? Anything you can ask.
Good morning, sir.
Good morning.
My mean is that if we have any idea, for individual person, I'm very individual person and I'm a PhD student. So I don't have any kind of links that I'll transfer my idea. So my mean is to say that can we have some on net or like the websites you are saying, can we connect them and send in our idea? Can they will give us some money or fund to elaborate my idea?
No, the system doesn't work that way. So if your idea is good, so you need to produce a preliminary data. Supporting data is required. The supporting data, once you qualify that their terms and conditions, then they'll call for interview. Okay? Then further there is a process. So it will start.
Thank you.
Hope that answers, right? No? Go ahead, no problem. You can speak. You can ask him. If you don't understand, you can ask.
No. Thank you, sir.
There are schemes by BIRAC and others.
Yes.
Where idea to POC, which is proof of concept, is there.
POC is there.
Yeah. So then they can go and apply to seed.
But anyway, my own experience, I got a BIRAC fund in 2017. But by entrepreneurship, that amount is not sufficient. So that is all.
So do you value your own company or outsource it? And if you do it yourself, then how do you do it?
I didn't understand.
So do you value your own company, the valuation of the company?
Okay. No, we don't do it, valuation. There is separate finance department will be there. So I am not expertise in the valuation of the company. Thank you.
Thank you so much.
Thank you.
Yeah, may I please request the co-chair to present the moment, sir?
Yeah, I'll leave on the fifth.
So I'd like to request Dr. Pooja Arora to felicitate our co-chairperson, Dr. Sushma Singh. So there's one more announcement. The certificates have started to distribute on the announcement desk outside the convention center. So the delegates can have the certificates taken from there.
हाँ ठीक है थैंक यू
Check, check.
एक ट्रे थी अपने पास।
So good morning, back again. We just come back into the panel discussion done by our speakers, and Dr. Shushma ma'am will be the co-chair, and she'll be side by side. She'll be a moderator as well. So the point is that we have a lot of opportunities coming up, and next 10 years, as Sir said, would be Indian scenario, which is coming up so well. So, but that point of time, please take it into point that you need to be more risk-oriented as one of your quality inside. That if we can take risk management, if we can actually manage risk, then only we should proceed further. And all PhD students, I think. I should not say you should not join jobs, but being an entrepreneur, that will give you a wonderful opportunity, and you're wise enough. You can easily ask few of your queries which you have, and wherever you feel like, opening few things, or you want to become a part of these teams. So please, we want your interactive participation. That is what I can say. So thank you. I open the session. I open this panel discussion from now. Fine. So please, sir, just few words what you have discussed, and then they'll ask you a few of the questions.
Hello, hello. So, in fact, thank you so much. Very well said. I'll give you an instance. Exactly a month back, as most of you are PhDs, I have a couple of very close friends. They are PhDs. They just completed from IIT. So they keep joking. PhD stands for permanent head damage. And one of my friends, she completed PhD, and she said now it's done and dusted. So I actually asked her why you said the word dusted, because I made the file and now it's kept in IIT. So I literally scolded her because she's very close to me. I said, this is one of the most amazing opportunity that you guys have, that when you're spending 5 years on an idea, as sir was beautifully mentioning, and if can convert into an idea which can actually generate money, then it's actually a business. And there's huge support from investors, from government agencies, and if you can make it fun, trust me, then there is no risk. The risk is when you take a burden and it becomes fun, and only thing is, as they say, last point, success beats success. If you have one paying customer of an idea, you'll stop sleeping, and trust me, and that is where you will start creating some magic. So that's what it is. So take PhD in a lighter note, not get stressed, but think this is my $1 billion idea, and every day I am contributing, even if your guide is scolding you. So it's an opportunity actually.
As Tarun mentioned is that, in my PhD, I'll tell you. So I was working on a certain enzyme called UZT. You might be heard about UZT enzymes in the gut, stomach, and it's present in everywhere in the body. So entire complex process, I was going through that complex process. Then it linked with the fatty liver disease. So that idea is evolved from my PhD thesis. Then we started developing a molecule towards the NASH, non-alcoholic fatty liver disease. So that's where you need to set your mindset. Everything is your mindset. So you need to understand, what you are thinking. That's the main thing. Nothing else here. So everybody does a science. Everybody does a business. But your mindset is in yours. That's everywhere. Everything is drives from your mind only. So take a risk. And, again I'm stressing, your PhD should become a enterprise. That is where, you start thinking. Once you start a startup and if you start thinking about accounting, marketing strategy, you cannot. It's again painful. So, my experience is so far it is good. So I would say venture into bioentrepreneurship, though it is risky but highly rewarding end of the day. That reward, you cannot imagine if you success in your field. Because anyway you are qualified by science. Definitely, maybe you see some failures. Definitely you get a success because you're already trained, in a certain way. Then you have to use your, brain that, achieve your business thoughts. But, bioentrepreneurship, especially in pharmaceutical, biopharma domain, you need to understand the entire pharma ecosystem, where you want to put yourself. Chemistry, preclinical, maybe clinical, bulk drugs, finished dosage forms, pharmacovigilance, in silico models. Where you want to venture depends on your, there you need to see the business opportunity. And there you need to see the, what you call unmet challenge. So you need to set this kind of mindset. Then definitely you can venture into the bioentrepreneurship and definitely you can get a success. But it is, any meaningful thing, it takes its own time. You need to have patience. Patience, always, you need to think and go. Very lean way. Lean startup always success. Lean startup. Think lean startup. Lean means very conservatively you should think and do the things. That's all.
So, like, I'd like to tell you a story about my friend's startup. He was last year working from home. He was doing the market, he's in the market research, doing the secondary research, where he has to do the cold calling to the different regions, different countries. So it was work from home like 6-7 months. He got a monotonous life. So he decided, let's go for a month in Goa. I'll do work from home from there. So we guys, as a friend, we just made a fun of him. Like, why are you going Goa? Save money, stay home. He stay for Goa 1 month, 2 months, 3 months. In the 4th month, we are getting a news he is starting a new business. So what was the business? When he went Goa, he met new people from the different regions, who is speaking different languages, who are native to their countries. So he got an idea that when I'm doing the cold calling in different regions, why can't I make a native speaker to do that? So he started a company with the name Multilingual Research, where he's providing modulators, translators. But it was just like an idea, and he just executed. He got 2-3 clients at the start, then he got a setback. For a month or 2, he's not getting any pay. Then he do the research about the company, what should I do, what is the target. So that's the basic thing. You have to do the research first, then execute your plan. And like we, the 90s guys, we are so much enthusiastic right now. The entrepreneurship has become a fancy word, where we think an entrepreneurship, yeah, I'll do that. We don't know any background about it. So that's it. Do your research first, make your protocol, then go for the risk management. If you are just taking a risk, then you are just taking a shot. You have to calculate your risk also. So that's it for my.
In fact, just one Urdu shairi on mindset. I got to know from somewhere and I repeat it. It says, on mindset, it's like सोच बदलो सितारे बदल जाएंगे, नज़र बदलो नज़ारे बदल जाएंगे, कश्ती बदलने की ज़रूरत नहीं, कश्ती मीन सफरिंग ना द बोट, दिशा बदलो किनारे बदल जाएंगे. So it's exactly what mindset is all about, how you think and how you perceive, and backed with research, I think the probability of failure gets lower. Yeah. Thank you. We're open for discussion.
Yeah, that were wonderful opinions shared with the students. So as a researcher, as a scientist, like we are like working in the lab. So any student who is a PhD student who is working, if one wants to start his or her own startups, what are the different stages? I think stages we have already seen, you have shown it in your presentation, but I think all these curious minds who are sitting here would like to know how to start. Idea, of course, will be theirs. The idea and the long-term risks have to be calculated, but how to move along with that idea and those basic requirements like the space requirements of funds and etc. The logistics, how it will be worked out. So maybe we can like discuss on that.
So a very good madam started with a good note. Any bio startup, if you get an idea, saying, see, I'll discuss my story, then you will understand everything. So right now my startup is working on fatty liver disease. So how did I get that idea? So from PhD I was working. My PhD topic also is mine, not my guide actually. So of course he supported a lot. He's a very nice person, nice human being, but very tough at science. So I shaped because of him. So from PhD, I was working in a particular enzyme, inhibition of particular enzyme in the particular disease. So all of a sudden, there is a statistics in Hyderabad. Out of 5 people, 4 people are suffering with fatty liver. Right? It is an unmet challenge till date. And the same month, Asian Institute of Gastroenterology, they started different wing on fatty liver disease. different hospital, different wing to cure this disease. Of course, we don't have medicines till date. It was only management. So this unmet challenge in India, it's going to be very challenging, and it will grow with your lifestyle. So then I thought that, okay, so how it is difficult to venture into these kind of things. I myself, I'm being a pharmacologist and pharmaceutical science background. For me, I know how to calculate risk. So I experienced earlier. So based on the risk calculation, I venture into this thing. So that mindset, risk mitigation mindset and idea generation, and really that idea is viable or not, end of the day. In the sense, if you spend quite some time and you get a failure, then you have to withstand that. That thing you required. And coming to the logistics and equipment and lab space, again, you need to understand what equipments you need to use for your research. LCMS, maybe some water bath, some etc., etc. So what kind of LCMS you want to use? QTOF, maybe 4500, 6500, SIX. So you need to have idea about all the equipment, all the processes. Then you can venture into these kind of things. Otherwise, what happened, the real scenario, you have to, run here and there, ask somebody. Before venturing into, again I'm stressing, before venturing into any bioentrepreneurship, you need to have a clear-cut vision, and in hand you need to have a protocol, definitely. Otherwise, end of the day it will be stressful to you. Fundraising and equipment-wise, space-wise, human resource-wise, and again, compliance, regulatory compliance. There are a lot of things are involved. I'm not scaring you, but this is a process. So you need to understand very, very clearly before venturing into this. Then the success is possible.
Hello. I just want to add one point and my learning, and I keep giving leadership talks in top IMs and other places across, and I just tell them one thing, irrespective it's a lab or a college. One of the fundamental things, money, equipments, I'm not a bio-entrepreneur, so I'm sure you will get it. And I just tell this one thing I keep addressing at all these top B schools is, I made the mistake when I was in my engineering MBA college. I made only 3-4 friends. Maybe I had the feeling that, oh, this guy is much better than me. But at this point, almost all my friends are vice president, president in top companies. One of my friend is president of a top fund, and I used to hate him. Jokes apart, we were not chasing the same girl, but still, we used to hate him. I used to hate him. But the lesson I'm trying to, in a light mode, I'm trying to tell, that be it a lab or a class, one of the things we forget, that the best help, the most amazing help is going to come from people who know you. Someone who's going to tell you, okay, this guy is putting money, I will put in reference, my mama ji or my papa has money. And after 10 years, some of you guys would be, maybe God's wish, CEO of Pfizer, Sanofi, you never know. And trust me, if you have fought with that guy or not spoken with him, do you think you will ever go to that guy for help? You will never do that. So one of the lessons I regret is that I did not make much friends in my college due to some reasons, and all are doing amazing. So help from, and money, as Sir said, is going to be very important. And you never know, because as Sir said, you need a team. So you need co-founders. So if you have best friends as your friends from college, I would love to put money, because then I know that this friendship is going to stay.
So adding to one more point to Gupta, when you start a PhD or master's, be humble with everybody, no matter what. No grudges. no egos. I'm just telling you out of my experience. Today, I started this bioentrepreneurship because of my friends. That's it. So, be humble with everybody, whether whatever it may be. I'm not going into detail. Be humble. So, you try to, make as much as good friends around you. Good friends in the sense, again, it's a bit debatable. You always need to have a good friends around you. Then these things will take you next level. These are very general things I'm discussing, but really in real life it works. It worked out for me. So that's you have to be very careful. So no egos at any point of stage. Any point of stage. It doesn't work at all. Be humble with anybody, especially bioentrepreneurship. You need to connect with many people. You need to ask help from many people. Maybe this guy expertise in his area. This girl might be expertise in this, some other area. So I need to take help from them. So it doesn't work at all. It's a people management and money management. Time management. These are very, very important, especially in bioentrepreneurship. Otherwise, see, in bioentrepreneurship results, very ambiguous. We don't know. But we in mind know, our mind know, will keep in a success, will go. But end of the day, we don't know what happens. Real scenario I'm talking about it. I'm not sugarcoating it, anything. But help, talking to the people, getting the knowledge from surrounded your, collaborations, very, very important. And equip with a good knowledge, very, very important, especially in bioentrepreneurship. Otherwise, dash. That's all from my side.
Like, I like to add a few things, like be humble, but you have to set standards. After getting an idea, like you are approaching your first client, he asks you to do things at a lower than market price. You do it. You do it because you want visibility, you want the first client. But what will happen if he comes again? You are going to do it at the same price. You have to justify him. What reason will you give to ask him for the higher pay? So you also have to set standards, not as compared to the MNCs, but you have, because you are investing your time in it, you have to charge for it. Unless and until you can't take that risk, you aren't going to be, because we also face this issue in our company. Because some clients, we also committed the price. We are doing the same thing, like research, what can I change? I have to give a new thing in the research, then only he is going to pay me more. That's the reason. So you also have to set your standards, you have to value your time, and at last everyone is doing everything for money.
So apart from that, I would like to mention one point here is that, being a scientist, you have an idea and, you have an entire process in your hand. But at the same time, you need to understand the business regulations, global business regulations, and domestic business regulations. And, it's very important that, for example, I'll tell you, any invoice you raise, every 10th of every month, you need to file the GST. And 20th of every month, you need to file the GST. So these things, being a founders, it's a very, very important. I have taken just example of GST. These financial things are very, very important being a founders. Don't miss these kind of things. And MCA filings, if you go through the website, internet, you will come to know. MCA filings, GST filings, these are the very normal procedures for every business. But when it comes to bioentrepreneurship, being a scientist, these are very new things to you. So before that, you need to get an idea about all those things. This is a very, very important thing. What I learned from, chartered accounts and finance people. So there, what is the use of learning this? I'll tell you. So you have a fund, say 1 crore fund in your bank. Then, if you understand this taxation and you understand this, your scientific experimentation, then the scientific experimentation, you understand what is the cost of that. And at the same time, the same cost is working or not, working with my company or not, definitely you can, estimate yourself. Not asking with CA. CA will give you different ideas that may fit into your basket and may not fit into your basket. But you need to understand yourself. To understand that, you need to have a good knowledge, minimum basic knowledge about all this, business regulations and tax regulations. Apart from that, marketing and all those things are very common. Eventually, if your startup grows, then it will add up. That's all from my side.
Actually, when we are born and brought up actually in the kind of environment that stability is must. I think all our parents have taught us this. That's the reason we are not coming out of that cocoon which, where we actually see ourselves. I also wanted to be an entrepreneur rather than sitting in a campus. So, yeah, it's a beautiful campus. The point is, generating an idea, you'll have n ideas. You'll end up to n different ideas every day at your stage. One person will say, yes, this idea is good, you'll start working on that. Second day, one other will come, you'll start working on the other same idea. So that, don't end up into the feasibility of things. So please, sir is very right in that case. Actually develop, these 5 years, don't spend it, only a scientific part. If you really want to be an entrepreneur, feasibility is must. Where I think I only taught into books. I was more into books like marketing research, project management, then statistics. Being into all these things, I definitely was a part and parcel into very good management B schools where, I not only learned with students, but I tried to implement a lot of things with them. So what exactly I mean to say here is that, there are two factors, critical success factors and critical failure factors. Nobody in India, especially, I don't know more about the other countries, but please keep on writing the failure factors more than the success factors. And once you know what is the failure of that, you review it. And people have started the same setup. You just review 10 different setups, cost benefit analysis, n analytical tools are there behind. At third year, I'm going to achieve that break-even point. So third year means where I can do it, at the second year I can achieve the break-even point. How will I do this? I have to make it a point that I am going to expertise, or I am going to have a project team of people, which is going to work in this area and this area side by side. Like when we talk about, charts like Gantt charts and so many other charts, where we actually set up the scheduling. So there are n tools where we can use, but the point here is your brain should always, you're sitting before the TV, but your brain should always be working that, what exactly I'm going to do. So first is read a lot of things, then after reading, go to the experts. Don't think that the money is wasted. Forget about the money. That capital is going to enter into your pockets automatically. So please, what you can do is meet the expertise, write out their points and critical, not only success factors, the failures, what they are achieving. If you work on the failures, you will definitely succeed. Fine? If I could not be an entrepreneur, I think I could foresee, I think all good brains sitting out here. So if I could foresee you into a better entrepreneurs, and India really requires it. So you need to be the drivers now, fine? Rather than like bio-entrepreneurs, that's all, or entrepreneurs, whichever area you're going to work upon. So I would like to have some kind of good questions.
So I have a question that once we are firm on the idea, then it is time for company registration and all the legal compliances. So how do we get started with the registrations and the legal compliances at first, and subsequently how do we deal about it? How do we go about it?
See, basically, actually, okay, sorry to comment that. Basically, once you get idea, nobody registers the company. So get an idea, you need to substantial with some data, statistics. The idea is worthwhile or not to drive further. Otherwise, I got an idea and go and register the company. Okay, go ahead.
Yeah, so after all that part, once we are done, how do we go only about the legal part?
See, there are two types of companies, LLP and private limited. So if you go company secretary, qualified company secretary, he will guide you. Nothing to worry about it. Don't even think about it. Okay? So only, as a madam mentioned, that you need to raise the funds. It's very important. Go and talk to the banks. You need to know how to talk with the bank manager. It's a very important aspect in the startups and any company. You need to convince the bank manager. He's not from your background, you're not from your family. So he's in a different perspective. You need to gain that experience, to crack that, how to get a fund from banks, And there are several, what you call, seed fundings are available from the government, you can apply it. Apart from that, original funds from banks. So that entire process, once you need to understand. So what I would suggest to you is that, in your PhD itself, your master's itself, if you really want to go to bioentrepreneurship or entrepreneurship, these steps, you need to get a clarity and go and talk to the banks. Look, I have an idea this, I wanted to establish a business, I want to get a loan. What is your process? He will say, you get out. Definitely he will say, you get out. So go to next bank and talk to him. Somewhat he will give some information. You're not satisfied. Go to next bank. Then somebody will, definitely will get a good information out of these three. That experience you required all the time.
So in a way, legal compliance is not something that we should really bother about.
You should know about it, but there is professionals are available, nothing to worry.
I would like to add even something deeper. So when you have, first of all, there is no firm up idea. I think you will realize when you start X, with the next thought process, you will end up with Y, 1,000. Is on? Hello, can you hear me? Yeah. So anyway, there will be 1,000 iterations that you will be doing along the process. So even saying a firm up idea will actually block your mind. Point number one, because then you will disappoint yourself, and then you will. Point number two, in my own experience, I opened my company 9 months after I started my idea. So all the funding, seed fund, even the Y Combinator, the top accelerator in the world, they never tell you to open a company, because the moment you open a company, your ECA, these lawyers, everyone is looking to, because for them you are a client. They will start asking money with GST. The first, from the top accelerator in the world, where we were a big part of it, they created Airbnb, Dropbox. They just say one thing: make a product quick and dirty and put it out in the hand of the consumer. Yes. Just cannot think, oh, I will make a company. Just, even if you have a product, if people are paying, collect cash, take it to mom's bank account. When you think it's worth opening a company, then only do it. Otherwise, you will fall into a massive trap. I don't know about bioentrepreneurship. Even in Bharat, I in fact opened the company when they gave me 50 lakh rupees at the standard one. And they actually give you an option. Are you an individual or a company? Never differentiate. If you have the solid idea, great education like you have had, and you can convince the 14 people, they don't know that you have a bank account, or they don't care. Once you're selected, within 4 months, they will say, okay, now to get money, open a bank. So do not put the horse, cart ahead of the horse. Very lethal. You will disappoint, you will waste money, your parents' money, everyone's money.
So till then we can operate as a proprietor itself.
Absolutely. No, you are absolutely convinced that this is because you start with X, you will make 100 iterations, and you will end up different, and then you say this is, because for that you have to do an MOA, AOA, you have to, in MOA, AOA is Memorandum of Association. In that you have to write what you are doing in the company. One day you are saying, I am going to sell samosa. Other day you are saying, I am doing a mobile application welfare. MO, it cannot be safe. So be extremely clear.
So, So adding to your point, that is where TBS comes, Technology Business Incubator, right? You go and talk to the TBA manager, look, I have an idea, I want to pursue it. So he will give you some sort of condition, terms and conditions, fulfill that. You work on prototype. If the prototype works, then you register a company. Simple. Nothing to worry.
One last question, sir.
No. You can ask many questions.
So normally we hear that a startup has to be innovative, a startup has to be different, it has to do something incremental change compared to existing startups and so on and henceforth, right? So when we look at already existing startups, let's say for a simple example, Zomato and Swiggy, they are doing more or less the very much similar thing. We are ordering food, they are delivering food, they are acting as delivery partners. If we want to register a change, or how does it differentiate them, or how could we differentiate ourselves, or what differentiates a startup from that?
So I fully agree with you. In fact, we make this joke in IIT that so in all the government grants, so all the reviewers get a sheet where they have to mark you on innovation, novelty, great, and team and all that stuff. And if you get more than 8, then you are selected. And I will tell you with all utmost shame, and even BIRAC people have also admitted that, and Sir is also BIRAC granted, 95% companies of BIRAC are nowhere. Because, and Zomato and Swiggy, because the problem is that when the problem is there and you are building a solution, there is a huge scope for others to come in. And as many Shark Tank people and everyone has said, it's a game of execution. So it's not, so innovation is a good kick you get in the night, oh, I'm doing something innovative. If you're not, someone is not paying for it, someone is not using, never be under an illusion it will become big. So Zomato, Swiggy, all these people paying for that service, that they have utilized a one simple thing that people want convenience, that they have stopped going out of home, be it harsh weather or they are unwell, and they have got used to it and people are paying for it. So trust me, there is scope for even 10 more startups like Zepto, 19-year-old guys, $900 million valuation, exactly similar, because I know the Zepto founders very well. They went to Y Combinator. They started in a place in Mumbai during COVID, and they delivered food to this another building within 10 minutes. And when they went to Y Combinator, they asked, okay, what was the feature that worked? And everyone said that, oh, this came in 10 minutes. And this is the biggest farce. I have used Zepto multiple times. Average time is 28 minutes. Because everyone playing on the same gimmick, 10 minutes. In fact, it was launched in, it was debated in Parliament that they should ban it. It has led to maximum road accidents, inhumane. So you know now what I'm trying to say between lines is you know the answer. How well you play with jargons also is also important.
So certainly this one's the last.
No problem. You can ask any number of questions. Okay. It's a discussion, right? You should understand the things.
We are aware. Yeah.
One request is that don't compare normal startups with bio-entrepreneurship. Okay. Bio-entrepreneurship altogether different mindset. I already keep on mentioning it. It's a different mindset, different process, all the together. So this normal startups, what you mentioned is, it's a different things.
So now that we've seen, startup is certainly hyped in a way that everybody wants to do a startup. Whereas with the same idea, I believe we could still stay small, grow organically, just not going into the private limited or LLP or anything, just proprietorship, and with time we could still grow with it, is what I believe. Then why do a startup over the former option? Or is it necessary or is it not? Yeah, actually registering a startup over just staying small and growing organically. Is it the need of the hour? If it is yes, why is it so? And if not, then is it okay to do so?
If you register your startup as a LLP or a private limited, you tend to get more funds. So because you're legalized, right? So you're accountable to the government, organizations, whatever, wherever it is. So registration is mandatory at certain point of time. And before that, again, I mentioned earlier, your idea can be generated as a prototype in your TBIs. A certain period, 6 months, 1 year. Then your prototype is ready, then it is a viable product. Then register your company and go with it.
Yeah, I think very good question. In fact, there's a very famous bookshop in very famous market in Delhi, Khan Market. So they are in existence for last 35 years. So they are a business. And Amazon came and Flipkart came, they disrupted the whole thing, took it online and gave the access in the app. And they are literally 10,000 times that Chand books that is there in Khan market. So that's the difference between doing the business and doing a startup. Business is, as I said, it's like sitting on a shop in a galla, that when a mithai wala goes in the morning, he has 500 rupees in his wallet and his father asks, aaj kitne leke aaye ho? If he says ki main 500 uda ke aaya hu, kal customer aayega, he'll be thrown out the next day. Whereas a startup is when you burn, where you put the product in the hands of the consumer, where you make it a monopoly. And when you make it a monopoly with $100 million in your bank account, then you charge, then it becomes what it is. And that is a difference between a business and a startup. Very simple.
Thank you, sir.
And one more point I would like to add is that, whatever experience you want to gain, start early. In the sense, at the master's level only, you should gain this business regulation, startup, and your idea development. At early stage, if you try to tune your mindset, then the failure rate will come very early. Then you will not disappoint at all. Then once you finished your PhD, my idea is this, and you're storing your idea in your mind, and I'll develop after PhD, and again it's a chaos, right? So my suggestion is, my experience is that at a master level itself, you develop that mindset. So yeah, look, I want to work in drug discovery. I want to work in formulation side, or maybe simulation plus. I want to develop some different software. So you set your mindset. At early stage, you expose all the things. Then you will, you left with nothing, either failure or success. That's it.
I think that's what it is. Another Urdu शायरी है, हर वक्त क्यों सोचे बुरा होगा, कुछ नहीं हुआ तो क्या होगा, तजुर्बा तो नया होगा.
We'll end up here.
You can give it to me.